We're all familiar. We've all seen TV shows such as House, Scrubs, or even Grey's Anatomy. We're very familiar with the typical scene of a doctor coming in to save the day during a medical crisis. We've seen dramatized versions of what doctors do all the time in media and in everyday life. But what is it really like to practice in this field, and how do you get there? To answer some of these questions, I was able to interview Dr. Miriam Ferns of Whiteville, North Carolina. Dr. Miriam Ferns is an internal medicine physician who has practiced medicine for over 15 years in North Carolina. She's not only worked with the typical patient who has general medical concerns, but she's also worked in the prison setting and also with patients who have suffered from drug addiction. I found that Dr. Ferns had a lot to share and a really unique perspective, so I'm happy to be here and to be able to share that information with you guys today. Some of the things I'll cover in my short presentation will be ideas such as how do you get into the medical field and what do you need to do to get there? Once you're there, how does practicing medicine intertwine with your own daily life? And how do you manage stress? I will also cover some unique topics that Dr. Ferns shared with me, as well as what she would change about the field if she were able to. To begin, Dr. Ferns told me that in order to become a MD physician, which is a medical doctor physician, you need to attend 4 years of undergraduate school, and this can be in any major. This was a surprise to me, as I thought you had to be a biology or a chemistry major, but medical schools apparently accept majors of all different types, from art to history to biology. The U.S. Department of Education released a study, however, that did state that the most common major that students choose is biology. After you do 4 years at an undergraduate institution, you then apply to medical school. Medical school will take you 4 years, and during these 4 years, you will receive on-site training and patient contact training, as well as a lot of, as Dr. Ferns described, book studying, where you will be learning a lot about the biology and chemistry of certain illnesses and how medications work. After you complete this 4 years of medical training, you then proceed to do a 3 to 5 year program that's called a residency. A residency is typically completed at a hospital anywhere in the United States, and after you've graduated from medical school, you will actually be matched with a specific hospital where you will do your residency. After residency, which is where you will specifically focus on the field of medicine that you have chosen to practice, then you are a certified doctor. So overall, Dr. Ferns informed me that the process typically takes roughly 11 years of full total training. I asked Dr. Ferns how she got into the field, and she told me that she always knew she wanted to be in a helping profession, and she recommended that anyone who is considering medicine is really in it to be able to help others. Outside of this, I asked Dr. Ferns, how do you manage the lifestyle of being a doctor? And does it have an impact on your family? And she told me that, in fact, she was not really prepared for some of the challenges of being a doctor when she entered medical school. She actually didn't know what the lifestyle would be like until she was in the lifestyle. Dr. Ferns told me that she has 2 children, and she sometimes wishes that she could spend more time with them. However, she does find her work rewarding and in that way feels fulfilled from her job. She told me that she manages stress by doing a lot of meditation and yoga, which is also something that she recommends to her patients. I thought that was pretty neat. Also, when I asked Dr. Ferns What are some things that you would change in the medical field if you could? One of her answers specifically stood out to me. She said that if she could have the chance, she would like to increase the amount of time that doctors are able to spend with patients. Dr. Fern shared with me that her typical patient appointment lasts 30 minutes, a little less or a little longer, depending on how much her schedule allows. But she shared with me that sometimes, especially with chronically ill patients, she feels that she would be better off if she was able to ask more questions and get more history than is allowed in the busy schedule of a doctor. I found this interesting because there were several studies, specifically one by R.L. Lowe and another by the National Institutes of Health. Both studies found some unique things. R.L. Lowe's study found that the shorter amount of time a doctor was able to spend with a patient, the more overprescribing of medications there was. The NIH, or National Institutes of Health study, found that typically doctor visits in the United States range from 15 to 25 minutes on average. And I was very surprised by that on a personal level. I have had longer doctor appointments and I've had shorter doctor's appointments. So both of those pieces of information were useful for me. And I found it interesting that Dr. Ferns commented on that. I asked her what she would do to make this change if she could. And she said that it would be great that each state already has an organization for all the doctors within that state. So in North Carolina, we have a program called the North Carolina Physicians Health Program that trains doctors on how to be able to actually manage stress in their own personal lives, but also keeps them up to date on different things going on in medicine and how they can improve the practice of medicine. And Dr. Ferns stated that she would find it really useful to be able to have a workshop at one of these NCPHP meetings to educate doctors on spending more time with their patients and perhaps scheduling fewer patients per day. Finally, to wrap it all up, I thought I'd end with a unique story that Dr. Ferns told me during our interview. I asked her to list a few unique experiences, maybe a moral dilemma that she's faced in her job. What she told me was actually pretty surprising. Dr. Ferns told me that one of the instances that stood out to her the most was a time when she was asked by a family of grandchildren, had brought their grandmother in to her office. Dr. Ferns had seen this patient before and had a history of her, but she came in on a particular day with her family. And different family members there were trying to convince Dr. Ferns that she should sign off on some paperwork that indicated that the elderly woman who came in had dementia to a degree that she wouldn't be able to manage her finances. Dr. Ferns did the examination and she compared it with the history that she had of this patient in the past. And she found that the patient in question actually did not have dementia. And it ended up being a very large and surprising conflict for Dr. Ferns to deal with, as it turned out that, unfortunately, this patient's family members had some financial interests at heart. To wrap up my presentation, I hope you guys enjoyed learning a little bit more about the medical profession, and I hope that this information has been useful to you. Thank you.